All right, what we're doing today is we're going to talk about wraparound. And if you don't know quite what that is, we'll talk about that part two. And I think, Vanessa, aren't you a nationally certified trainer?
Yes, I'm a certified local coach and trainer.
Okay,
hmm
okay. And then Elizabeth McDowell, who's the director of the Mississippi Wraparound Institute, is here. So we definitely have some experts on here about wraparound. But what we're going to talk about today is this idea of doing a research project. All of us, everybody on here who wants to, and anybody else who wants to come to the table to do some sort of research project. And I'll tell you more about what the opportunity is about wraparound. But we want this to be about everybody working together from the very beginning. Now, at Families as Allies, we did start by picking a topic, but I'm going to be real honest with y'all. If we get to the end of this and you hear about, everything, what the opportunity is, and you think, nah, we shouldn't do this about wraparound, we should pick something else. That's fine. Whatever you think today, and as we go through this, is fine. Um, and then we'll all work together on those questions and issues. But this is basically what's happened is there's this opportunity, not even to do research, but to bring everybody together over the course of a year. We can get funding to do that, or we can apply for funding to do that and bring everybody, families, people like youth, people who evaluate research, the systems, and I'm very excited because I think we have several people from Medicaid. I know Linda Stewart's on here from the Department of Mental Health. All the systems together, people who pay for services, which would include Medicaid, our managed care partners, and say, bring everyone together for over a year and make a plan, or for a year, with probably 3 big convenings in there, and say, how can we all work together to develop a research project that would really tell us what the people receiving the service and what their families think is important to get out of a service or an intervention. So in looking at this opportunity, one thing that we've looked at Families as Allies is, first of all, and if this doesn't all make sense, we'll figure it out together. If we do this, if we all work on this together, needs to be some sort of intervention that is evidence-based or a really promising practice. So not everything that happens, even things that are good and things that might really help your child or might really help you, it doesn't necessarily have an evidence base the way that gets defined in research. Correct me if I'm wrong, the wraparound experts on here, but wraparound does. So that's one reason we thought about that. And then also, when we talk to families and about the different things that they face and different challenges they come up against, it seems like if wraparound's working the way it should, that a lot of those challenges are better addressed, that they get the support they need. But if it's not going the way that's helpful to them, that doesn't necessarily happen. It's also a service that's for, or a care coordination model that's for children with the most significant needs. And to us, it makes sense to focus on children with the most significant needs if we're looking at what's most helpful. And then so much good work has been done in the state. We have a lot of infrastructure. We have the Mississippi Wraparound Institute. They're subject matter experts. They train, they provide coaching. We've got 2 systems. All of the systems are involved with wraparound, or touch on it probably. Um, but like Medicaid and mental health have been really involved in it for years. So we've got 2 state partners, if they think this sounds good, um, who would have a lot of information, and we also hope investment too. So that's kind of how we came to be talking about wraparound today. And what if we do some sort of research project on that or work together towards being able to do that? But I'm serious. If you listen to this presentation today or what we discussed today and say, I think we should focus on something else, that's perfectly okay too. So that's kind of how we got here. Does anybody have any questions at this point? All right. And did that make sense? Y'all can tell me if it didn't.
Yes, it did.
Okay. Okay. If ever, like, as we go through this stuff, if it starts not making sense, just stop me. All right. This funding, if we decide to do this, is from the Patient-Centered Outcomes Research Institute. And we're going to look at what that is. And some of this stuff is going to look really dry. And I think maybe even kind of intimidating. But I also think once we start looking at it, we're going to ooh, this sounds pretty family driven, which is the stuff we're normally talking about when we get together for meetings. So let's look at what the Patient-Centered Outcomes Institute is. Let's see. Okay, so this is a patient-centered patient-centered outcome research institute. And I know we try not to use acronyms, but everybody calls this PCORI. So if you hear that, that's what people are talking about. And this is their homepage. Let's just look at what they do. And I know everybody can read, but I'm going to read this so we can kind of think it through. Okay, so PCORI funds comparative clinical effectiveness research. And of course, they use another acronym, SIR. All right, that's not necessarily going to make much sense to us. But these words, that helps people, so all of us and all of us with kids and our kids, make informed healthcare decisions. So the whole goal is so that the people who are actually using the service can use whatever research has been done to say, how do I want to use this to help me or help my kid? So to make informed healthcare decisions and improve healthcare delivery, so make the service work better and outcomes and improve the outcomes. So this is all about like, how do the people who receive the service and their families, what information do they need to make better decisions and not to improve them on how they make decisions? That's not what we're talking about. We're talking about what information do they need about an intervention or a service, like something about wraparound, to improve how it works for them and for them to get the outcomes that they want for their child and family. And the way this happens is by producing evidence from research. And that's what we would be looking at, is how could we all work together to design a research project that, listen to this, is guided by patients, their caregivers. So that's what they start with. Like, how would we do a research project about wraparound or whatever that's guided by the people who are receiving the service, which would be children and families, their caregivers, which includes families, and the broader health and healthcare community. So that's all those people we were just talking about. The systems that have an interest in that intervention, the people who provide the intervention. And that's one thing I'm not sure of, is if we have people on here who actually do wraparound facilitation, we might. The people who train, like the experts in the state, like the Wraparound Institute, the people who are paying for it, which we have Medicaid on here. We may have some managed care folks, I'm not sure. And then we have the Department of Mental Health. They set standards. They're making sure they're monitoring. So it's bringing everybody together. So that's what PCORI does, is it funds research that looks at, does this, first of all, include the people receiving the service and their families from the very beginning? Is it based on the outcomes they say are important? So We at Families as Allies, as far as I know, nobody who works at Families as Allies right now is getting wraparound care coordination for their children. We might just say, well, based on all the calls we get, we think this is an important outcome. But families who are receiving it might say, well, that's what you might think that's what you heard, but this is really what would work for us. Or, someone from like Medicaid might think, oh, well, this is a really good outcome, but families might say something else. So it starts with what are the outcomes that families are looking for? And then how do we design a research project so that families can judge the results of that research to see if they got the outcomes they identified as important? But all of us working together on that with input from everyone. Okay. So that's the basic idea of the research. Any thoughts or questions at this point? And I'm going to show you a couple other things on this website that explain this in a little more depth so we can see if we're on. I got to look up the link. Oh, whoops, I'm sorry. Okay, I just made all my stuff go away. Let me see if I can find it. I'm going to go back to the PCORI website. Are you guys seeing, and I can't see you nod. Could somebody tell me, are you still seeing the book? Oh, it's paused. Hang on just a second. I'm sorry for my technical difficulties.
No problem. It's so fun when this stuff happens.
It is. It is. Okay, we're going to look at, there's these foundational expectations, and then I'm going to show you the actual, let's see what we get with this. Oh, yay, I remembered the right thing. Okay. So I may erase all my stuff in the middle of talking, but okay, these are, in doing this type of project, what they expect. They say, if you're going to get this funding, this is what we expect to see from the very beginning. And they mean this conversation right now. Okay. All right. Representative involvement should include partners, organizations, researchers, and other team members who reflect a range of patients and communities affected by the topic. Early and ongoing engagement. And look at this, it should ensure that partners contribute early and throughout the study, including planning, conducting the study. So that means everybody working together on the research, not just some on down the road PhD level researchers doing it and then they come tell us what they did, but everyone who wants to helping do it. Dedicated funds for all of those things. So if you're helping with that, you'll get some money. That we would build our capacity to work as a team by doing this. And that would mean we'd identify skills, strengths, and barriers to engagement and provide all of our team members with the information, training, and support that we would all need to work as a team. Because if we do this, it's not going to be easy. There's going to be things where people aren't used to working with other groups of people. There's going to be words people use that others don't understand, experiences that might be shared. So we've got to figure out, like, they expect us to build our capacity to do that, not just with this project, but on an ongoing basis. Meaningful inclusion of partners in decision making. So all partners, that's everyone on here right now, include partners in decision making throughout all phases of the project with consideration of the project's goals, the scope, and the scale. And then ongoing review and assessment of engagement. So through this whole thing, we're looking at what is our engagement like? Is everybody at the table? Is everyone contributing? Do they feel like they can contribute? What do they need to be able to contribute? And some of the things that we're probably going to see if we do this is people who may not be as used to listening to what families want, and I'd like to get youth involved too, may need some support in learning how to do that. Families may need support in being able to say to a researcher, I don't, those words you're using, I'm just not getting it. Or what you're saying might, you think is important. I'd like you to think about this too. So there's going to be, we're going to have a way to have really honest feedback with each other. Okay, now I want to show you the specific proposal we're looking at. Then a couple other things, and then I just want us to talk. Okay, so what this is, we're going to look at all funding opportunities. Most of these are about a bunch of really high-level research that is not what we're talking about today. They have these engagement awards, and that's where we are. And there's 3 different kinds of awards, engagement awards. The most simple one is the convening support. And what it does, and I'll put this link in the chat. This opportunity, I'm going to start right here, supports projects that include multi-party convenings, meetings, and conferences. So it's bringing us all together, which bring together communities of patients, families, caregivers, and other members of the broader healthcare community. They must align with the mission of PCORI and help expand patient-centered comparative clinical effectiveness research. And so it has to show how we will expand this kind of research by doing a project together. And that might be, and again, we'd all decide what that looked like. That might be everybody working together to get to where we could submit a proposal altogether for one of those other research projects that I was saying, we're not going to do that. We're not there yet. It might say that we'll develop a structure where we can have a way of developing those proposals. It could be a lot of different things, but it's got to move us more in the direction of being able to do this kind of research as a group. So that's kind of where we are at Families as Allies. And then I want to show you a couple other things. Some of you may not be as familiar with wraparound. And I'm going to show you, and there's probably, I don't know if this is the best way to do it, but I'll just show you. On our website, so we're looking at Families as Allies, and if that's not what y'all are seeing, tell me. You can go to our website, resources, helpful websites and documents. And there's there's this section on wraparound information. If you've never heard of wraparound or you're like not sure what it is, because sometimes people think, oh, that's just where you make sure people get a lot of services and you're very patient-centered with them. That's a good start, but that's not we're talking about an actual high fidelity wraparound approach that the state uses primarily in the mental health system. And these 2 documents, and if I'm wrong, y'all that know more than I do about wraparound, tell you what that process looks like. So if you're not familiar with wraparound, that's a place you can look. Okay, I'm going to stop sharing. Okay, now I'm gonna stop talking and y'all tell me, or tell us, because it's about all of us, how this is all hitting you. Does it seem like something we should do? Are we on the right track? And let's start there. Like, are we on the right track looking at something like this? And are we on the right track thinking maybe we should look at wraparound? So I'm just gonna be quiet and listen.
A question, Ms. Hodge. Since we're working with families, do you think it would be beneficial if a survey or an assessment was given to them to see what their needs were first?
Like to find out if they even think this is a good idea? Is that what you're
Or,
thinking?
or just seeing what their needs are as far as us helping them with those needs? Because us helping and not knowing their needs is kind of pointless. So we have to know what areas they need help in.
So we need more information from families. Is that what you're thinking?
Possibly. I'm
Okay.
just asking.
Okay, that's a good idea. And on this we did, and I have no idea if anyone on here is actually receiving wraparound. We did try to do a lot of outreach that we wanted those families especially, to be in discussions like this, because you're exactly right. So a survey might be another good way to do that. And we might be able to get some help from the providers if getting that out. So that's a good idea.
Hey Joy, this is Kate
Yes,
at
ma'am.
PA. Hey, so I just want to make sure that I understand. So this would not be a proposal to actually do the comparative research. This is more like the planning phase for a potential research project. Is that in a nutshell?
Yes.
Okay,
Yes.
okay. Just making sure
So,
I was on the right page.
right. So that we could all take our time, get to know each other, really learn about this approach, get more practiced at having everyone at the table and learning, how everybody communicates and bringing all that together. Yes. So this would basically be a planning for a year, bringing people together around this so that we could, if at the end of that we choose to submit a proposal, we could. And that also gives the state agencies some time to learn more, because I know they need a fair bit of information to decide something like that. Any other thoughts?
I love the idea of setting something in motion to hear more from families about the impact of the process, right? I think it's important. I think it'll be really interesting. I will say, and this is, since we're just kind of thinking about planning to plan, this might be early, but I do know that any sort of research around does wraparound work does have to be paired with efforts to make sure fidelity is in place as a connection, because it's, there's a lot of non-negotiables within it that make wraparound. And so if those things aren't in place, research would be measuring something fully different. So that's definitely a consideration we'd have to be keeping in mind as we move forward.
Yes, we need to make sure that it's a high fidelity process that we're looking at, which we do have some fidelity tools that could come into play. So it might help.
And PCORI is also going to demand, I'm not saying they're going to demand like bang their fists on a table, but this proposal, if we got to that point of saying, yes, we're going to submit something, we would have to show them that what we were comparing, that those were evidence-based and were being done with fidelity. So yeah.
Okay.
And I did the national wraparound people and Eric, what's his Burns, they know that we're thinking about this, and I invited them to be part of this too, because I guess for some of the reasons y'all are saying, but I don't know what everybody thinks about them. And to be really honest, I couldn't find their emails since they changed universities, so I sent them invitations to this through my WOVA app or whatever you call it, and they're not here, so it must not have worked, or else they couldn't be here. But
if Wort's available, they'd be great partners, because they definitely do a lot of thinking about even different models across the country, but just ways of measuring fidelity and then taking that into what's happening in the field. So they'd be great partners if they're available.
Is that where Eric is?
He's
Yes.
at work.
Okay.
And
'Cause I
and we
thought-
have a contract with them right now that just started too, so
Okay.
that might
So
help.
you probably have his email.
I do. I
You won't
do.
have to contact him. And I talked to him at a meeting, well, that meeting we were at a few weeks ago, but so. Any other thoughts and I'm just curious, like, when y'all listen to this, is it like, oh yeah, that's, that seems like a good idea, or I don't think we should do that, or that's too much, or it sounds good, we should do it this way, but we should do it this way. And is it hitting anybody or is anybody thinking that made no sense? Just
I definitely think this is a good idea, especially serving the community. I'm always in.
thank you for reminding me to put the link in the chat. Here's the link to the funding opportunity we just looked at. Y'all are so quiet. Is there anybody who's thinking, I just don't think this sounds like a good idea, or that it sounds good, but it should be about something other than wraparound, like that's for whatever reason not good? Just any thoughts hitting anyone that way?
Joy, and of course, I'm just bringing this funding opportunity up to look at it. But do you have to determine the topics, the projects or topics that you would be considering in this discussion, or is it just more of an agreement of all the parties to come together to determine the topics? So would we have to decide now that it's wraparound, or would that be a natural process that we would go through to either rule in or rule out wraparound during the actual discussion of research topics?
I think it would be the second thing you described, because, and I'm learning a lot too. I do have a little bit of experience with PCORI and like talking to them. And this is my impression right now, and I could be wrong and email y'all in 15 minutes and say, whoops. But I think what has happened before is typically there's something in a community that the people either who have that condition or their families or who are affected by it are saying, we'd really like to look at this. And that's what starts to bring everyone together. But you're right. As everyone comes together, there may be this realization of, oh, we need to step back, or it's really this thing over here that is most important to people, or is most affecting this issue, or this needs to be first. And I think the only parameters there are as we look at what do we come out with at the end. And it may just be something as simple as now we've got this structured group where anyone can come with any kind of research idea, and we all, put it through this process and help each other. That may be our outcome. But if it was like we want to look at another intervention or something that happens in some sort of system, it would, that kind of thing would need to be something where it was evidence-based, or however they define that. So, but I think there's a lot of flexibility. So we wouldn't be committing to wrap around. Even if we put something in that said, this is what we're going to look at, we're not saying at the end, we're going to do a project about wrap around. Any other thoughts?
think sounds great, like a really worthwhile project to get the community together to think about ways to learn more about what's working, and move towards um, a specific initiative. I think that sounds great.
And I know Justin Sarver wanted to be here today, but he must not have been able to at the last minute. I know he was saying he would just love to have a group because he does research at UMC. A lot of y'all probably know him, he's a psychologist, where he could come and say, this is what I'm thinking about doing. Give me your what y'all think. And, to have that on an ongoing basis. So this might get us closer to having that kind of place where people can come. Oh, and one other question, who else needs to be here? No matter where this leads us, but if we're going to do this process, and one is youth. Can y'all think of other groups that might not be here today, or they may be and we don't realize they are, but other groups that should be here?
I'm wondering, like, so definitely youth and families, but I'm wondering about providers.
Yes.
So,
I was hoping we had some providers. Well, we've got Vanessa represents a provider organization,
yeah, that's true.
but yeah, we definitely want more.
I think if we're looking at, kind of targeting a population, of high risk youth or families, that we would want CPS involved, and just other, providers, and not necessarily wraparound providers, but, other mental health providers,
Good points.
and if we have, like if someone from, UMMC, that serves a lot of high risk patients, and they do research, so that's a plus.
Yeah.
A 2 for 1, yeah. And certainly those with lived experience, I think that's
Yeah, that's the most important.
yeah.
Do you think that it would be, and I'm just thinking about the incarcerated youth stuff that we're doing, like to have like a representative from like a JDC or a judge or something like that, just because, if we're looking at using wraparound for those youth as well,
Mm-hmm.
getting them involved in this and, and then ultimately using that as a selling point, ideally, to get buy-in from the juvenile justice system later down the road for referring those youth and using those dollars that they have for those youth,
A very good point.
whether that be like Tony Kirsch or somebody from Oakley or whatever the case may be.
And
Good
I think
idea.
that, oh, sorry.
Oh, go ahead.
No, and I think that all of us on here, we can contribute some form of fashion. A lot of us have lived experiences and may not be providers. So I think we all can contribute in some form of fashion with lived experience as well. Myself could contribute with lived experience with mental health.
Thank you. Yeah, we definitely have people on here with lived experience as parents. I know that. Not necessarily that I've received wraparound, but yeah, that's a very good point. Any other thoughts? And then I want to ask one question. And I apologize, I didn't ask this at the beginning, and you may if you have a feedback for me about this, you're welcome to tell me now or when we're offline. I did not ask at the beginnings. What we typically do in a discussion like this, if it's recorded and this is recorded, is we share it out in a blog so that people who weren't here who wanted the same information can learn about it. If that is not okay to anyone, for anyone, which is fine, because you may have said something you'd prefer not share or whatever. If you could let me know either by sending me a private message in the chat or if you can contact me, at Families as Allies too. But otherwise, I'll give a little bit of time. We probably will share this out. So others, and that may help us, if everybody's okay with that, start getting more people to the table. And I don't want to put you on the spot, Linda, but did you have anything to say from the Department of Mental Health perspective? If you're where you can talk.
I am where I can talk. I had a hard time getting my mute button off. I'm just looking at it. I pulled it up just like Kate did, and I'm just kind of looking at it. I mean, we'll support any way we can. We know how important if wraparound is what we decide to go with. I mean, we will definitely support and provide whatever information and effort into it. And I've been on a couple of PCORI calls with others, so I'm a little bit familiar with it, but I am reading over it. I'm learning a lot. So anyway, yeah, we're definitely want to be part of the team, and we'll do what we can to support and provide whatever we need to provide.
Thank you. Appreciate that. Any other thoughts? And we're actually gonna, actually the clock on my computer is fast. We have about an hour. The next thing that will happen, well, we'll continue, we will probably have some more meetings like this. We might do something in person, but the next deadline, there's a letter of intent that is due towards the end of September. I think it's like 28th or 29th. And I think that's within that link I gave you. That would be something we would all be working together on. For anyone who wants to help with it. And we would, we can take, I don't want to ask anyone to write a grant application for free. We can take that on as Families as Allies as far as the actual writing. But making sure that it reflects what everybody's saying. And if there's anybody who's thinking, yeah, I really want to write a letter of intent, you're more than welcome to help with the actual writing. But we're not trying to impose that on anyone. And then everybody would like give input and be reading, and everyone who wanted to could edit drafts and all that stuff. So that would be then that and probably additional meetings, and maybe some like the surveys y'all were talking about, and probably having some times where families can join in after hours, maybe on weekends, that type of thing, and that anyone can join, but making sure it's at different times to make it more accessible to families. Any final thoughts from anyone? Well, and I think we do have someone on here for me. Let me see. I just noticed that. So, well, I really, really appreciate everyone being here today. And unless I hear differently, like today or tomorrow, we will go or today, Monday, we probably will go ahead and share this out as a blog. So, everyone can have the information, but thank you all so much. And if you think of something else, just, holler at us over here at Families as Allies. Okay. Thank y'all.
Bye,
And
everyone.
bye. And we end our meetings with go forth and conquer at Families as Allies, because working together, there's nothing we can't do. Bye, y'all. Go forth and conquer.